I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, I'll be answering 23 questions about blockchain. Let's get it started. The idea of blockchain was first envisioned in 1991, so it's not new. But the technology we know today emerged in 2008 when Bitcoin was created. The Bitcoin blockchain was invented by Satoshi Nakamoto. This is a pseudonym, so no one knows who Satoshi really is. Well, this is a good question. A blockchain is an immutable and distributed ledger of information. Because it is distributed, the information that is recorded on a blockchain cannot be tampered with. So blockchains ensure the integrity of the information they hold. Well, a distributed network is made of computers called nodes that each store a copy of the blockchain. If one user tampers with the ledger, all the other nodes would cross-reference each other and easily pinpoint the node that has the incorrect information. This ensures the integrity of the information. Well, there are two types of blockchains, permissioned and permissionless. Permissioned blockchains are similar to an internet system. Only authorized parties can access it. On the contrary, permissionless blockchains, such as Bitcoin, can be accessed by anyone. Yes, data stored on the blockchain can be encrypted. Well, the more nodes there are in a blockchain, the harder it is to hack it. The most famous blockchains we know today are nearly impossible to hack. Well, this is a very interesting question. I would say that one key difference between a typical database and a blockchain distributed ledger is the way that data is structured. A blockchain collects information together in groups, also known as blocks. Every time a block is filled, a new one is created. Just like a bottle of water, when you fill one, you get to the next one. Each new block is chained to the previous one, thus creating a blockchain. There are three major applications for blockchain in healthcare: ensure data integrity, track digital assets, and automate sensitive processes. Today, healthcare organizations mainly explore the use cases of blockchain in clinical trials, supply chain, and patient data management. Well, a blockchain can be sort of an immutable audit trail to keep track of all the sensitive information produced during a clinical trial, but also ensure to patients and regulators that data hasn't been tampered with. There are currently several projects focused on the use of blockchain for the pharmaceutical supply chain, including vaccines. These projects are aiming to connect all the parties involved in the distribution of a drug to improve transparency, responsiveness, but also trust in the supply chain. Some companies are looking into the use of blockchain as a way to create an immutable proof that a patient is immunized against COVID-19, either because he received the vaccine or because he naturally developed antibodies after catching the virus. Well, this is a tricky question because blockchains are not designed to store large volumes of data, such as entire electronic health records. However, blockchains can be used to install advanced access control to data. Well, that's the idea. The immutable ledger can be used to define access rules to sensitive information. This can be implemented to control access to the full data or to parts of it. Patients will therefore be able to decide who has access to their information and who hasn't. In the blockchain ecosystem, a token is a digital asset that can be transferred between two parties. Yes, some companies have developed their own tokens that can have a multitude of uses. They can, for example, represent a digital version of a physical product like a vaccine. They can also be used as a form of currency to reward users based on their actions. But one of the biggest projects today is the Pharma Ledger Consortium. It gathers over 20 of the most important pharmaceutical companies in the world to create a blockchain infrastructure specifically designed for the healthcare industry. They focused on use cases such as drug supply chain or the protection of data in clinical trials. I believe two things: education, as it is still hard to understand what blockchain is designed to do, and governance, because it is a true challenge to have multiple organizations with divergent interests sit at the same table and work on a common project. That it can secure medical records. Blockchain will not replace cybersecurity measures. It can only guarantee the integrity of the information, not its security. Well, I guess all use cases that involve the supply chain. One of the reasons being that they don't make use of personal information, as it is the case with applications in clinical trials or patient data management. Once personal data comes into play, the complexity increases. Organizations regained interest in blockchain during the COVID-19 crisis. One example of that is that the World Health Organization is working with a consortium of European companies to develop blockchain-based vaccination certificates. I think blockchain is a technology that is here to stay. We have a convergence of large investments, committed organizations, and a need for more transparency and trust in healthcare. If you want to continue this conversation, head over to our website for more content and the unique opportunity to sign up to our next conference. Thank you so much for watching, and I'll see you next time.